Vaginal estrogen, vaginal estrogen benefits, safety, and why so many women are not offered it. Okay. Do you know about vaginal estrogen? Do you know that it is the female Viagra? Okay. So if you don't, listen to this video because you're going to find out all the things about it. And yes, it is the female equivalent to Viagra. Okay. So if you're there suffering from painful sex, recurrent UTIs, burning, dryness, any of all of those things, and you've been just told that that's a normal part of aging, no, absolutely not. Misinformation. All right. I really truly believe that vaginal estrogen is one of the most underutilized, misunderstood, and life changing treatments in women's health. Okay. Vaginal estrogen, it's not systemic hormones, not what most people are afraid of. And for so many women, it is literally game changing, life altering, game changing, even women in their 20s. Okay. Vaginal estrogen is low dose local estrogen that's used to treat changes in the vagina urethral tissue that happen when estrogen declines. So often this starts in perimenopause, right? When we know hormones are going chaotic and crazy. So not just in menopause. Also, though, vaginal estrogen is actually, I have a lot of 20 some year olds on it that are breastfeeding because breastfeeding is also an estrogen deficient state. So a lot of these girls will need vaginal estrogen while they're breastfeeding. Okay. It comes in creams, it comes in a ring. And its job simply is to restore tissue health where estrogen receptors are and are extremely dense, which is in the vagina. Okay. So vaginal estrogen improves vaginal dryness, irritation. It improves pain with sex. It improves burning and discomfort. It is the number one prevention for UTIs, right? It helps with tissue thinning and fragility, and it helps with elasticity and blood flow to the vaginal tissue, which is why it is equivocal to female Viagra. The vaginal tissue is very hormone sensitive. So as we lose those hormones, the tissue does not become as reactive. So a lot of women will say, notice changes in their orgasm. Either they can't have an orgasm, or now it takes, 10 years, or now they have to use all these toys when they never did before. And I do want to tell you, newsflash about orgasm is only about 10% of women can actually orgasm from penetrative sex. 90, and that's normal. 90% of women can orgasm with clitoral stimulation. So it's normal that if you can't orgasm with just penetrative sex alone. But sometimes that goes completely away, and vaginal estrogen can fix that. It is used to treat, genital urinary syndrome and menopause, which is all the things that we're talking about. But remember how powerful estrogen is. So remember, 400 processes in the female body. So in the vagina, it increases blood flow, collagen, elasticity. It helps with pH balance. It helps with vaginal microbiome. So guess what happens? This is not a joke, ladies. Women in their 70s and 80s, if they do not use vaginal estrogen, their labia go away. Did you hear me? They go away. Okay? They literally shrivel up and go away. This is terrifying. I don't know about you, but I do not want my labia to go away. Okay? Vaginal estrogen can fix that. One of the other things that it can help with is also some incontinence because the vaginal wall shares a wall with the trigone of the bladder. The trigone of the bladder is also very hormone sensitive. And so sometimes vaginal estrogen can help with that too. Okay. Here's a couple of things that I want to be very, very clear about because women are misled all the time. Vaginal estrogen is not systemic hormone therapy. One more time. Vaginal estrogen is not systemic hormone therapy. What does that mean? That means that even women who have had breast cancer or other reasons why they potentially may not be able to have HRT can use vaginal estrogen. Okay. There is very minimal systemic absorption because it is so low level. All right. So it's considered very safe. And some of actually the biggest cancer institutions do give it to their, their breast cancer females. Okay. Why? We kind of touched on this. Why is it called the female Viagra? But it's because it improves blood flow, restores tissue responsiveness, decreases pain. And remember, pain is a libido killer, right? You're not going to have sex. Your brain, remember, libido is in the brain, right? So check out that YouTube video that I did because that's killer. So your body is going to protect itself. If you have pain, dryness, cracking in your vagina, your brain is not going to tell you to have sex. Okay. It's just not going to happen. The body is there to protect you. Okay. So when sex stops hurting, the nervous system doesn't see it as a threat anymore. And women will actually say their libido goes up with vaginal estrogen, not just that they feel better, they have, they don't have pain, their dryness is gone, and they can orgasm better, but that literally their libido goes up. And that is because it's safe now, right? And so the brain says, okay, you can have sex again. All right, we'll give her those thoughts again because now we don't have any pain. Okay. Who should consider taking this? Everybody. If you're over the age of 40, vaginal estrogen for everybody. You don't need to be old. You don't need to be menopausal. If you're experiencing problems, of course, discomfort with sex, dryness, UTIs, burning, all of that, have it. And then I would also say that, I personally believe that vaginal estrogen is amazing and everybody should be on it. So if you have any signs of, estrogen deficiency, I would be on it. We're kind of far from this, but, I would say that, if you're a woman over 40, you should be on vaginal estrogen. Okay. So why, if this is so great, Dr. Sarah, why isn't everybody on it? Well, here's why. Women's sexual health is still minimized. Okay. We see this a lot with testosterone, but I've heard women tell me that their OBs who were women told them their vaginal dryness, pain, all of that, that's just the way that it is. And at 51 years old, you're just going to have to deal with it. You're not going to have sex anymore. And that's just it. What? Excuse me? No. Fear around estrogen, right? And we all know we've debunked that. So we're not even going to legitimize that at all. As women, we normalize suffering. We need to stop doing that. Start saying our symptoms. Stop suffering in silence, right? When you're out to dinner with your friends, be like, you have some vaginal dryness, right? Do you have cracking? Are your labia going away? Right? Like we have got to have these conversations, ladies. Part of this is we do it to ourselves. We suffer in silence. No, no, no. We have got to demand what it is. So literally, the takeaway from this is if sex is painful, if you have UTIs, if things are dry, vaginal estrogen is one of the safest and most effective places to start. And the other cool thing about vaginal estrogen is you actually can use it on your face to improve skin quality. Now, there's some keys to that. Again, if you have, hormone positive skin conditions, right? So like melasma, for example, that estrogen may make the melasma worse. So it's not for everyone, but for those that can do it, that's pretty awesome, right? You take care of your UTIs, your vaginal dryness, you increase your orgasms, you increase your libido, and you get skincare. Hello. Yes, 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 yes. Okay. Women don't lose intimacy because we stop caring, because we're old and that's just what it is. It's because our bodies are changing and no one helps us adapt to that. Okay. So vaginal estrogen for all. Okay. If this video helped you, if you, gave you information you didn't know, please share, like and subscribe, of course, but please share this with a friend. The more women we educate, the better, ladies. Okay. Vaginal estrogen for all. And actually check out my YouTube on libido because it's a very important topic for women. And another thing that's misunderstood, right? Because nobody wants to talk about women and having sex. So until next time, stay well.